Hello guys, I'm Carlo Lifato Balan live from Barangay Kabaguan. My topic is all about protecting yourself from COVID-19 in the workplace, safety and health awareness for workers. I-off ko lang yung camera para mas malinaw at mas malawak yung nasasakop ng slide. Thank you. Hello. Protecting yourself from COVID-19 in the workplace, safety and health awareness for workers. This presentation by itself is not sufficient training for personnel who have potential for occupational exposure to the SARS-CoV-2 virus. Personnel must be trained to their employer site. Specific policies and procedure training must include practice in putting the taking of PPE and respirators and performing decontamination procedures until the competencies and confidence can be demonstrated. Information in COVID-19 is rapidly changing. Sometimes daily refers to reliable sources such as CDC, OSHA, NOSH, State Health Department, and peer-reviewed science publications. Ito yung mga reliable source na pwede natin tingnan about sa COVID-19. Employer and worker responsibilities. The responsibility of employer and the workers. Employer and the worker have responsibilities under the OSH Act. The Occupational Safe and Health Act requires that employers provide a safe and healthy workplace free of recognized hazards and follow OSHA standards. Workers should participate in the development and implementations of the employer safety and health policies and help ensure that they are appropriate and implemented. This is the worldwide distribution map. COVID-19, US distribution map. Pandemic declaration. On March 11, 2020, the World Health Organization o WHO characterized COVID-19 as a pandemic. It has caused severe illness and death. It features sustained person-to-person spread worldwide. Person-to-person spread worldwide. Pangkalahatan na, ang buong mundo. It poses an special high risk for the elderly, 60 or older, people with pre-existing health conditions such as high blood pressure, heart disease, lung disease, diabetes, autoimmune disorders, and certain workers. What can individuals do? Ito yung mga dapat gawin ng bawat isa. Be informed and prepared. Siyempre, be informed and prepared. Kailangan maging prepared ka sa lahat ng bagay. Sa ano? Wear a mask. Magsuot ng mask. Maintain social distancing. Kailangan 6 feet. Wash your hands frequently. Use alcohol-based hand sanitizers. Avoid touching your eyes, nose, and mouth. Stay home when you are sick para hindi makapaghawa. Cough or sneeze into tissue or your elbow. Clean and disinfect frequently. Touch objects and surfaces such as cell phones. 5 steps to proper hand washing. With your hands with clean running water, warm or cold. Turn off the top and apply soap. Lather your hands rubbing with together with the soap. Lather the backs on your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Need a timer. Hum the happy binder. At least 20 seconds. Need a timer. Hum the happy birthday song from beginning to end twice. Your hands while under clean running water. Dry your hands using a clean water to air dry them. Wait, lather, scrub, rinse, dry. The 5-step to proper hand washing. Precautionary principle. When it comes to work safety, we shall be driven by the precautionary principles that reasonable step to reduce risk should not await scientific certainty about the natures of hazard of risk. COVID-19 basic. What is SARS-CoV-2? SARS-CoV-2 is the virus that causes coronavirus disease. 2019 COVID-19. SARS, severe acute respiratory distress syndrome, is spread easily to person to person. Little if any immunity in humans. Transmission. COVID-19 is spread from person to person nga, mainly through coughing, sneezing, and talking and breathing. Droplet, aerosol contact, other possible routes. First, the droplet. Respiratory secretion from coughing and sneezing landing on the mucosal surfaces, nose, mouth, and eyes. Aerosol, solid particle or liquid droplet suspended in air. Contact, touching something with SARS-2 virus on it and then touching mouth, nose, or eyes. Other possible routes, through fecal matter. Incubation period. The incubation period is the time between exposure to virus and the onset of symptoms. With COVID-19, symptoms may show for 2 to 14 days after exposure. CDC indicates that people are most contagious when they are the most symptomatic. Several studies show people may be contagious before developing symptoms. COVID-19 can cause mild to severe symptoms. Most common symptoms include fever, cough, shortness of breath. Other symptoms may include sore throat, runny or stuffy nose, body aches, headaches, chills, fatigue, gastrointestinal, diarrhea, nausea, loss of smell and taste. Most people, severe symptoms, emergency warning signs for COVID-19. Most people will have mild symptoms and should recover home and not go to the hospital or emergency room. Get medical attention immediately if you have difficulty breathing, of shortness of breath, persistent pain or pressure in the chest, new confusions or inability to arouse, bluish lips or face. What is a person under investigations? A person who has both consistent signs or symptoms and the risk factors as follows. Suspect case. A potential exposure within 14 days before the onset of symptoms. Symptoms including cough, fever, and shortness of breath. Confirmed case. A confirmed case is a suspect case with laboratory confirm na diagnostic evidence of SARS-CoV-2 virus infection. Ito talaga yung COVID-19 kasi na-confirm na. How long does the SARS-CoV-2 survive outside of the body? How long does the SARS-CoV-2 survive outside of the body? It is not clear yet how long the coronavirus can live on surfaces, but it seems to behave like other coronaviruses. Virus may persist on the surfaces for a few hours or up to several days depending on the conditions and the type of surface. It is likely that it can be killed with a simple disinfectant or in the info-register list below. Ito yung link. Disinfectant. Sorry. Increased risk of severe illness. COVID-19 poses a greater risk for severe illness for people with underlying health conditions, heart disease, lung disease, such as asthma, diabetes, suppressed immune systems. Seasonal flu versus COVID-19. Seasonal flu versus COVID-19. COVID-19 has the potential to cause more deaths and hospitalizations. Ito may cause talaga na posibilidad kang mamatay, tapos posibilidad kang hospital. SARS-CoV-2 is much more infectious, so spread faster than the seasonal flu. SARS-CoV-2 is more infectious and spread faster than the seasonal flu. Okay? So far, case of fatality CFR of COVID-19 is estimated to be around 2%. The CFR, seasonal influenza, is estimated to be around 0.1%, making SARS-CoV-2 about 20 times more deadly than the seasonal flu. An estimated 15 to 20% is infected individual may suffer from severe symptoms that require medical attention, including the pneumonia, wet shortness of breath, and lowered blood oxygen saturation. No treatment. Immunity unknown how long it lasts post-illness or vaccination. Pandemic influenza experts have been recommending preparedness, warning about the likelihood of future pandemic influenza outbreak for decades. Flu pandemic facilities worldwide the last century, noong 1918 between 40 and 100 million, noong 1950-70, 2 million, noong 1968, 1 million. The deadliest pandemic. Treatment and vaccine. In December 2020, the FDA gave emergency use authorization to COVID-19 vaccine, with many more on the pipeline. There is no specific FDA-declared medication or treatment for COVID-19. Treatment is supportive. People who are mildly ill with COVID-19 should isolate at home during their illness.